Bismillahirrahmanirrahim. Hello and welcome back, friends. Welcome back to another video lecture by Kami Microbiologist. Today in this video lecture we are going to see another lecture that is related to vitamin profile, and it is about the vitamin B6 test. Okay, so my name is Muhammad Kamil Khan and you guys watching my channel Kami Microbiologist. If you guys remember, we already talked about different vitamin tests, like we have talked vitamin B1, vitamin B1 2, vitamin B3, vitamin B5. Now this is the vitamin B6 blood test. Okay, so now let's start the video. So in this video, what are the main content that we are going to explain? First of all, we will see that what is vitamin B6, then we will see function of vitamin B6, diagnostic purpose of vitamin B6, test procedure, deficiency of vitamin B6, normal range, main causes of high and low vitamin B6. Let's see that what is actually vitamin B6. It is actually called as pyridoxine, or we can call that pyridoxal 5-phosphate. Okay, next, vitamin B6 is again, this is the part of vitamin B complex family of vitamins. It is also the essential vitamins, means we cannot our body cannot make it, and it can be obtained from the diet or supplements. It is also water soluble vitamins. Now the normal range of vitamin B6 is 5 to 15 microgram per liter. Let's see the function. So the function is it can metabolize magnesium and calcium. So I already explained the magnesium and calcium. If you don't know about the magnesium and calcium, you can go back to my channel and watch the video lecture about that. Next we have it can metabolize protein. So due to the metabolism of the protein, it will give us energy. It can maintain the normal level, it can maintain the normal nerve function. It can boost our immune system. It also help to maintain the sugar level in the blood. It is also important to make the RBC. It is also help in the brain development. It help to balance sodium and potassium level. It help to balance homocysteine level in the blood. Now let's see that what is the diagnostic purpose of vitamin B6. So this test is especially used to diagnose the deficiency of a disease which we call that peripheral neuropathy. So peripheral neuropathy is the neurological disease, or we can say brain related disease. As you can see on the computer screen, this is the peripheral neuropathy disease. It can monitor the treatment efficacy. It can diagnose metabolic disorder. It can monitor vitamin B6 excess, means it can find out the level of the high level of vitamin B6, like we can say toxicity. It can evaluate nutritional status. Now let's see that in which diet there is a high amount of vitamin B6. As all of you guys better know that we have a lot of diets, but here I am going to explain you some specific diets in which vitamin B6 are in a large amount. So first we have spinach, milk, egg, chicken breast, banana, sunflower seeds, pistachio nuts, watermelon, fish. So these are the diets, although there are some other diets as well, but these are the main diets in which vitamin B6 are in a large amount. Now let's see that when the vitamin B6 level get low, so what will be the symptoms? So the symptom is inflammation of the skin and tongue, irritability, cracked and lip sores, tingling in feet and hand, muscle weakness and difficulty in walking, weakness and fatigue, depression. Now let's see that what is the procedure of vitamin B6. So the procedure is that first of all you have to take the blood in a DTA tube 12 hours on fasting. Then you will centrifuge the blood to separate this plasma, and you will run the plasma on advanced machine or fully automated advanced machine or semi-automated machine to get the value of the vitamin B6. As we already talked, their normal range. Let's see that what are the main causes through which the vitamin B6 level get low. So it is due to the vitamin B12 and folic acid deficiency. It is due to the malabsorption syndrome like ulcerative colitis, celiac and Crohn's disease. It is due to alcoholism and rheumatoid arthritis. It is also due to the long-term use of isoniazid, which we use it for the TB treatment. It is also due to the kidney disease. Okay, So if again we talk about that, what are the main causes through which the vitamin B6 level get high, so it is due to the supplement of the vitamin B6 supplement. So dear viewers, this is all about the vitamin B6. I hope you guys get idea about that, and I hope you understand. But if still you have any question, you can write your question into comment. I will try my best to give you answer as soon as possible. Thank you so much for watching. If you like this video, so make sure to hit the like button, share this video, and subscribe the channel to get more interesting videos like that. Thank you so much.